I did not prepare like the PowerPoints and all that nonsense, because I felt like this should just be a conversation.
I came to introduce you, but.
Oh, I'm Elizabeth Brant. Yeah, I'm a nephrologist. I work at Dartmouth. I trained here at UNC for 4 years. In fact, I did 2 years of a general nephrology fellowship. We do a lot of vasculitis even when we're doing our general fellowship. And then I did 2 more years of just glomerular disease, focusing on vasculitis. And at Dartmouth, I do general nephrology, but more recently do just very recently, now about 95% of my time will be all kinds of glomerular disease. The weird and the wacky, I can say, and enjoy. My favorite. My favorite. So, so this is the newly diagnosed. So I was kind of thinking about this, and I thought, well, to me, this is kind of like a clinic appointment, right? Somebody just gets diagnosed and they come into my clinic. And I tell them when they come the first time, I go, I'm going to tell you way too much, way, way, way too much. And I don't even want you to try to remember it. At the end, I'm going to tell you what I need you to remember from this visit, because you're going to hear it again and again and again and again. So that might be kind of what today is like. But one of the other things I was thinking about is, what exactly is a new diagnosis? And I think that might vary from person to person. So to the extent anyone feels comfortable doing so, how many people were diagnosed or are a caregiver for someone who was diagnosed less than a month ago? Nobody. 3 months. 6 months? A year. Less than 3 years. Less than 5 years. Barely. Yeah, so that's kind of my point. It's like, what do you define new? And so my sort of little joke that I make is that it takes 5 years before you get to the point where you're not worried about this constantly. It's always that thing that's there. Every little thing is, oh my God, is that this? Is it the vasculitis? Is it the vasculitis? Is it that? And you can make yourself a little crazy. And then, as Dr. Fogg was talking about, and I've seen this so many times, the patients I saw during fellowship and patients now, is they get to the point where they know, they just know, yeah, something's not quite right. It's just not quite right. And you listen to that. And the other thing I was thinking about is when you're first diagnosed, what are you feeling? So another survey question. How many people before this diagnosis were really healthy? Did not have a whole bunch of medical problems. That one, what I found is that by and large, patients, and this is totally anecdotal, I have no data to show you. One day I would like to have this data, I probably never will, is that the patients who get vasculitis are healthy before they get vasculitis. And I personally think that's really, really rude. That's just really, really rude. You know, I've seen 49-year-old guy, and this was a few years ago, and very fit, rode his bicycle everywhere. I got dusted my throat. I got sick. That's from me running my mouth too much. And he knew something was wrong when people were passing him on his bike, because he was always ahead of everybody. And he comes into the hospital. And this is a terrible story. I'm just going to tell you now, it's a terrible story. It does not apply to you, but I'm just sort of making the point. Super healthy. And within, I'm going to say 2 months, no more than 3 months, he was deceased. It was terrible. It was just one of the worst, maybe the worst case I have ever seen, ever. And I've thought about this for a long time, like, why is it the healthy people? Megan, why is it the healthy people? Why? Who get vasculitis? Why?
Perfect storm.
Could you just figure that out for us?
We would love to know, like prospectively, who's at risk.
Yeah, if you could
And if
just,
they're at risk, avoid certain potential triggers we think might be.
yeah, that would be super duper. I'll leave that in your hands. There you go. And so I think that initial diagnosis, and again, I'm looking out to 3 years, is there are a lot of feelings around that. So some that came to my mind were confused, really confused, because now somebody's told you you have a thing that you have never heard of. No one you know has ever heard of it. And as Brandon was talking about, you go online, if you get old data, then you're terrified because you're gonna die. You're just gonna die. You're not gonna die. I mean, you will one day, but not right now. Maybe you're mad, like just really angry. Scared, that's the big one. And of course, in my clinic is, am I going to be on dialysis? Am I going to be on dialysis? I get that from every patient, not just the vasculitis patients. Oblivious is another word. I was that person, frustrated, maybe a little bit of denial. I think that goes along with oblivious. So pick your choice. So I guess from you guys, because again, I could sit here and babble all day, but I'm not gonna. You hope, is what has been your experience as a as defined by you, newly diagnosed person? What are the things that you feel like are challenges to you, or maybe things that you're like, there's actually a positive out of this, if you can think of one, or just, what are your thoughts? Don't make me pick on you. I'll come to every single one of you. Don't make me do it. Don't make me do it. So
I'll start with the positive.
Okay.
So Susan, my wife, is the person that actually has I still call it Wegner's because I cannot get that name.
just say GPA is fine.
GPA come together. So we got very fortunate in discovering hers because it actually was initially skin related. It was having something with her eye that we thought was just removing a cyst. And she was actually, it just kept coming back. And so finally had that taken care of. She had the little minor surgery with whatever this particular doctor was. He came back, they were running some tests. They came back, oh, you have this, something that starts with an S, sarcoidosis maybe, or something close to that.
Yeah.
And then the next thing they come back and says, well, actually, it's not sarcoidosis. You actually have vasculitis. And then, of course, you look at that, you vasculitis, you go, oh, in 5 to 7 years, you're going to be dead. This is really extrapolated considerably since we had the cyst removed.
Yeah.
And of course, then we started fortunately looking and finding out, well, it's not a good thing to have, but it's not nearly as bad as it could be.
Yeah.
And very fortunate. But then it got to a matter of like, okay, who do you find that knows anything about this? And that's the part that's been the challenge. So, and she's had opinions and second opinions. And I think they've got a pretty solid diagnosis, but it's still like, it's just so rare. And her experience, unfortunately, has been like with other medical conditions, is sometimes the treatment is worse than what you get. And she ended up having, in my opinion, more of the whatever the good drug is that they've known about.
Probably.
Yeah, they gave her 1,000 instead of 500 initially for both of the treatments. She's very, very sensitive to medicine. And by the time they got around to this treatment that she had, this next to last treatment she had, she actually developed some sort of heart palpitation thing that I think may have been related to too low of potassium or something or other. At any rate, that's in the midst of being fixed now. But again, it was a matter of who do you ask? It's like it's one thing if you find a rheumatologist, then you say, I'd like to find a cardiologist that knows anything about vascular, that knows anything about, which A is
GPA.
that knows anything about GPA. My grade point average was pretty good. I mean, but so we're blessed as compared to some of the stories that we've heard.
Yeah.
So
Yeah.
it has been apparently caught early.
Yeah.
And so now it's a matter of, I kind of think about it. Okay, this is something you don't want to have, and you want to get ahead of it because if it gets ahead of you, then it can get much worse.
Yeah,
So
for sure.
So thus we're here.
I actually have a patient who came to the big meeting in July, and she's like, yeah, it was good, but I feel like those people were so much sicker than I am. And it's all I could do not to just die laughing, which I could do with her because I tease her because I'm like, are you going to cry today? Are we going to cry today? She cries about everything, happy, sad, you name it. She Dad, why are we crying today? Well, I'm just so proud of my boys. I'm like, yes, I know you are. I'm proud of them too. Stop crying. Enough of the cry. No, she's delightful. But I'm just laughing at her saying they're so much sicker than I am. I'm like, Deb, you do realize you've been in the hospital 4 times, right? Because you get COVID every other day and then you can't breathe at all. And that sort of thing. But so it's beauty is in the eye of the beholder. So she, by the way, is doing very well. My friend, her rheumatologist, sent me texted me images of her lung CT the other day, clear as a whistle, gorgeous, just gorgeous. What else have you experienced?
So I was recently diagnosed 3 months ago. And they first, before they got the diagnosis, they went through this whole long list of like horrible things. And finally we got there within like about 2 weeks in the hospital. So that was good. But then I had all these questions, so a lot of anxiety. I have trouble accepting that it's a chronic disease, that I gotta, live with it. I thought I was doing all these good, healthy things before. So, and because at this point, I'm feeling really good. I'm feeling like, I don't feel sick. I have no pain. And I'm thinking like, okay, well, maybe it's just in my head. So is this real or not real?
Yeah.
And do I need to be concerned and stay on top of it? But I've been trying to be really vigilant because I sense that my doctors, as good as they are, they don't really have experience. They can look it up, but I feel like I have to be at least very well informed and maybe a step ahead of them and trying to anticipate and get them collaborating. And so it's been online, trying to do a lot of research. So it's been really stressful, but I feel like once I get to that point where I really have an understanding and I know I'm with my final team maybe versus this interim team and things smooth out, then I think I'll be a lot better. But again, it's just the not knowing, and we don't know
Right.
if a flare up or if I'll get into remission or not.
Mhm.
And I think it's some of that unknown.
Mhm.
And then hearing some of the scary things, one lady lost her vision overnight, another person losing their hearing, you don't know what part of your body is going to be affected. And so I just really can't take that for granted. And I feel like, boy, I really need to do the things I really want to do now, maybe,
Mhm. Mhm.
rather than wait.
But if you were diagnosed early and got treatment early, then obviously you're far less likely to have any of those
That's-
things happen.
That's my goal.
But the only problem we've ran into is she's got like 7 different doctors now. They
Yeah.
never talk to each other.
Ugh,
It's like, it's
That's
not a
crazy.
unified direction of what to do.
yeah,
And none of them really know that much about vasculitis.
yeah. So you have to have, I feel like that one core person
Yeah.
who is the bus driver. And even like, I am very, very close with our rheumatology service at Dartmouth. Like, I feel like I'm part rheumatologist. I do so much with them. And we always, do you want to do the immunosuppression? Do you want me to prescribe it? But we'll talk to each other about, what do we think is the best thing to do? Do you think we should use this med or how long? Yeah, so, but.
Having that multidisciplinary
Yeah.
team that's working together. And
But
that's,
we don't have like, I'm saying one thing and they're saying something different, and then I come back and say something. We don't do that. We just chit chat a lot. So, and you do have to be vigilant. And this is sort of the thing I was talking about is, I don't know where I came up with this magic number of 5 years, but for 5 years, that's going to be the worry, is what's going to happen next, what's going to happen, because it's so different for everybody. It's like, oh, losing your vision well, that just sounds super, doesn't it? Or hearing, that's another one, that I don't see the vision often, but I see the hearing. Am I going to suddenly have a pulmonary hemorrhage and be in the ICU intubated? Oh, all the things. And if you have kidney involvement, am I going to be on dialysis? Yeah. So it's a challenge. And I think that goes on for a very, very long time. And as Dr. Falk talked about this idea of restoration of health, because, and I'll talk more about this in the kidneys session this afternoon, is you can have your vasculitis treated, you can feel great, but you still may be left with permanent injury, chronic kidney disease. And that can be very frustrating and a little scary for people. So, yeah.
Do you agree a rheumatologist is kind of ground zero for doctor?
Not necessarily. And I always laugh when people say that because I'm like, I'm not a nephrologist. No, I don't think so.
That's the main reason I asked.
Yeah, no, and so it was sort of funny. We had a board meeting October maybe. And at least one of the other board members, there are 3 of us physicians on the board, but one of them was surprised to learn that I, as a nephrologist, see patients who don't even have any kidney involvement. And that's because I treat vasculitis. I don't just treat renal vasculitis. So, and I would say that's probably true for most. But again, as I joke, even with my rheumatology colleagues, I'm like, I can't do a joint exam. Like your knee, if it was this big, I might go, I think you've got a problem with your knee there. Maybe we should, I don't know. Or, you know, I don't know if you've got inflammation in your synovium. I don't know. And so that's where I go, will you just look at this? Those joints and things. I don't know how to do that. That's not my thing. And pulmonology. I mean, I can have my suspicions. I can do a good physical exam on the lungs. I can do imaging of the lungs, but I'm still going to send them to most of the time, to one of my pulmonology colleagues and say, what are your thoughts on this? Here's what I'm thinking.
And are those colleagues, are they like pulmonologists that kind of have another specialty in vasculitis?
Not necessarily. It's people that I have personally targeted and said,
Yeah.
they will become my vasculitis sidekicks. And I will say that I have yet to have one of the pulmonologists manage the immunosuppression. I have dermatologists send me patients who have a skin vasculitis, and they may or may not have renal involvement. They don't do the immunosuppression. They send them to me to do that most of the time. Because they don't want to get into prescribing steroids and the whatnots, you know, oral steroids. Yeah, so you start with whomever you start with. If your first symptom is lungs, that might be who you see first and might be the one to go, something is not right here, and figures that out. And they may be able to diagnose and go, but I'm not comfortable treating it. And so they may say, let's get you in with who. And it's a lot of time going to be a rheumatologist, but as far as I'm concerned, and I think most people are concerned, it's not an owned disease. It's we all own this disease and all need to kind of manage it together. So, but it's a good question. Even if I don't like it. It's a good question. What other thoughts?
I'll go. Back to your first question, you said, what did we feel when we were diagnosed? And one thing you didn't list was what I felt was relief.
Oh, yeah, that
Because-
is a good one.
Almost relief, but also like, I told you so kind of thing. So a mixture of both of those, because it took me almost 5 years of advocating for myself, knowing that something was wrong and having doctors not listen to me. I had one doctor call me crazy to my face. I was told vehemently, like, you do not have an autoimmune disease. And I kind of want to go back and be like, really? Not only do I have one of the most rare ones you'll ever see. It was a lot of that, like really pushing back for a long time because it's so rare. And I was the Behçet's question, and I am the only one that was in that room. So it's been hard because I've never met anyone with it. My doctors I'm usually their only patient, and I have doctors that treat every body part from my head to my toes. And I feel like I spent a lot of time being their teacher
Yes.
instead of them helping me.
Yeah.
I actually had a doctor say to me, can you educate me? And I was like, sure, but that's not my job. I will, because
You're gonna pay me the fee.
right. I'm like, I want you to help me. So I will tell you, but I shouldn't be doing that. I'm the patient.
Yeah.
So that's a lot of what my general experience is most people don't know. I have doctors that are kind of just treating me as they see me in that moment. And I don't know that they're taking the whole context of the illness in general. And then even with Behçet's, there's very little funding, just like most vasculitis doesn't, completely underfunded. It just doesn't get enough notice. And if I tell people about it, it's kind of a longer conversation. You can't just say like, oh, I have this. Whereas I was telling a girlfriend of mine, not that you compare illnesses or diseases, but if you were to walk into a room and say, I had cancer, you might find people that you can have a community with. And I don't have that. And that is sometimes the hardest thing. And I'm almost 4 years out from my diagnosis, but I still feel like a new patient. Partly because I don't know anyone, and I'm still trying to find doctors that listen and can treat all the different issues. So yeah, that's kind of my experience.
You're on that island by yourself.
I say that all the time. I'm like, I am an island.
Yeah.
So
Yeah.
yeah, that's
Well,
how I
We had a
feel.
great conversation with Dr. Orzakowski.
I did.
And I would guess Joyce would be the one to know. There will be somebody at the VF who knows. A lot of the diseases, I had a patient who had cryoglobulinemic vasculitis, which is also very, very rare. And there was like a patient like, what do they call it, like a community page of patients
Yeah,
where they would share stories and, here's what I'm going through, here's what I did, blah, blah, blah. And so something like that, just so you don't feel like you're the only one on the planet.
yeah.
dealing with this.
And it's hard because, I mean, most of us have probably felt this, but you don't necessarily look sick on a day-to-day basis. And I still managed to do everything I did before I was diagnosed. And because I don't look sick, that's a whole nother component that is not discussed enough. It's not that people don't believe you, because that would be pretty crappy for someone to say, I don't believe you have an illness. It's just
believe it's as bad as it is.
exactly. And it's sort of like you get this judgment and then you kind of minimize your own feelings. Like you were saying before, like, is it really that bad? Like your friend saying, "I'm fine, I feel lucky." And so most days I'm like, it's not that bad. But then if you were to talk to someone in this room, they're like, no, it's bad. Like, this is what you experience. So it's a lot. It's like a mental game sometimes, because you put yourself in front of other people and you almost silently judge yourself in the way that they are. So it's a lot more than I think getting a diagnosis and treating it. It's just like just like I'm sick from my head to my toes. I feel like it's a circular thing. You're just constantly in one little segment of this loop trying to figure it out.
Yeah. And the not looking sick, I think, is a real problem. That same patient is like,
Yeah.
the patients here were so much sicker than I've been. And she doesn't look, if you saw her, you would have no idea how horrible this respiratory disease is that she's had. And if she's had any kidney involvement, it has been so minor, really, really minor. And even to the extent that she said to me one day, she's like, I don't think my husband gets it, that how bad I feel. And it's, you just can't explain it to people that you look fine. And the reality is, and this was another thing I wanted to bring up. So I'm sort of glad I'm about to say this, but you still have to function, whether you feel bad or not, whether you look bad or not, unless you are independently wealthy and you are going to have caretakers who come bring your soup to your bed. You gotta, as I will use the phrase, you still have to get up and walk the dog. Like, you can't just not do anything. And so I think that becomes a bit of a challenge. What was the thing I was going to tell you? Something about doing things. Oh, this brain of mine. It's very sad. It's very sad. I'm bearing down on 60, y'all, and it's really rough.
Someone this morning mentioned about staying active, not necessarily being exercised. I know that's big.
Yeah.
Susan's way better at it than I am. I'm the healthy one.
Yeah.
So-
No, I am notoriously bad about being active. I'm like, well, I walk from my car to my office. It's like a quarter of a mile. Yeah, it's 800 steps. Shush. I will sometimes, if I'm on the inpatient service at the hospital, I have been known to walk 4 miles in a day, just walking around the hospital. It's not that big of a hospital, people. It's that's saying something. Shoot, what was that other thing? It'll come back to me in a minute. Yes.
I follow up on his,
course.
in terms of being active, and I don't know a lot of this stuff, but I'm thinking like, if there's inflammation, a constriction of blood vessels, the blood has to get through, if you're like really working out hard, is like, do you get doctor clearance, or you just kind of judge it as you go? I mean, can you do more harm? I guess.
So I would,
Overdoing it.
yeah, so I would say probably not. The one caveat is if you are on prednisone does tend to predispose people to muscle tears and tendon tears. So don't do heavy duty exercise, like don't go running a lot, lifting heavy weights while you're on a fairly substantial dose of prednisone. And what do I mean by fairly substantial? Because that just sounds dumb. I would say if you're on more than 10 milligrams a day, you should probably still be pretty careful. You can be active. Walking is not going to do you harm. Very light weights is not going to do you harm. Some cardio stuff. It's actually a really great question. I don't usually have people thinking in depth about what their actual blood vessels are doing. I would think if anything, what's going to happen is your blood vessels will dilate, because because you're hot, and that's what blood vessels do when we're hot, to sort of cool off, and also just to allow greater blood flow. So it's the ones that are badly injured and are kind of kaput, those aren't gonna get better, but
I'd love to play tennis, but probably wait till I'm on a lower dose. So
yeah,
because that's a lot of start stop.
yeah. And I would think, I don't know about whacking ball, but yeah, I can't do that either.
Susan, and part of it is knowing your own body, and that's knowing
Yeah.
what they do before. So Susan and I actually love to kayak. She's much better at it than I am. I live in Richmond, but if we're gonna kayak, we're gonna open the park. You know, we're gonna be done and loading the kayaks back up by noon, because when it's in the summer, putting the kayaks back on the top at 90 degrees, whether she's got vasculitis or not, that's not gonna happen.
Yeah.
We're gonna do it earlier, we're gonna do it late. So it's a matter of kind of knowing yourself. And we also both suffer from another disease for which there is no cure. It's the cure that you don't want. It's the 60itis. The cure that I see is the 70itis, and I don't think that's so that, but things just don't work the way they used to in some
I think
cases.
60itis started a little early. I'm
Well, that.
kind of appalled and offended.
I don't know what you can do, but we definitely get out and try to walk regularly. And she's always said she's much nicer when she walks, and I can confirm after 30 seconds.
I'll tell her you said.
That's true.
We won't say. So Brandon mentioned something, and it came up, I think, in one of the questions is, and I can just remember this so clearly. Fatigue. Oh, good Lord, have mercy. People do not understand what this means. And so I try to impress this upon fellows and residents and students or whomever is in my clinic. You should always, any patient, not just somebody that's you're seeing in my GN clinic, but GN for glomerulonephritis, and that's why we say GN, because that's too hard to say that other thing. You have to ask about fatigue because it is a different fatigue. I think everyone in this room can probably attest to that. There's fatigue like, whew, I had a long day. I'm super tired, or it was a busy week. I'm going to sleep in this weekend. And then there's the real life. I'm going to take the bus from work to home. That's going to take 30 minutes. I'm not going to be able to stay awake on the bus. I'm going to get home. I'm going to feed the pets. I'm going to eat dinner. I'm going to fall asleep again. I'm going to get up. I'm going to do whatever last little things I have to do. I'm going to go to bed. I'm going to sleep all night, and it will be all I can do to get out of the bed the next day. And on the weekends, probably going to sleep late, get up. I'm going to need a 3+ hour nap in the middle of the day. I'm going to get up. I'm going to get it's constant. And I describe it as, take your pick. One of the many descriptions is it's like somebody has put sandbags on you. You cannot physically lift your own body or move your own body in space. It is not, oh, I am so tired. No. It's horrible. It's to me, it's one of the worst things, because that to me is the thing that's so debilitating. Like, we can work through our kidney injury, unless, like you're super sick from your kidney injury, but hopefully that's not the case and you're getting your medication or whatever. And you can work through the cough if you may have some respiratory issues, that's maybe you're a little short of breath, but the fatigue, you literally cannot function. It's terrible. It's terrible. So if you have had that, I am so sorry, because it stinks. That just stinks. Yes, ma'am.
For me, it's almost like I can feel, when I feel the fatigue, it's like the oxygen runs out of my muscles. Like, my muscles are not getting oxygen and they cannot go any further. And it's usually in the middle of walking, going anywhere. I'll just be like, I can't go any further. I've got to stop.
I just got to stop. Yep. Anybody else have?
It's taken away my love of going to Target.
Oh, no.
Never forgive.
Did you say
Target?
Target?
I get a park and I think, oh, when I walk in, it's gonna be fine, get my basket. Halfway through the store, it's just like,
It's just
I can't do
so
it.
hard. It's just so hard.
Exhausted.
I would have the same problem as far as going to a fabric store and rather than Target, but.
So is this part of the disease or part of the medication or part of the damage to that, like your organs are not getting the oxygen?
I'm gonna say it's all of the above, but I will tell you it is most certainly part of the disease. Pre-diagnosis, it is one of the things that I think people will experience quite a lot. But it's also, and it's actually been studied, it is such a striking feature of disease that it has been studied. Why do people have this horrible fatigue? And the fatigue, and you guys tell me if this has been your experience, the fatigue persists after you've been treated, after you're in remission, the fatigue just goes on and on and on. And we don't know why. It is not purely a function of inflammation. We know that for sure. That was studied. People's inflammatory, not just the sort of generic inflammatory markers like sed rate and CRP. People have looked at other inflammatory molecules and things. They're not elevated. So we don't really know what that is. Now, if the fatigue will change, you might not need to sleep. Again, I exaggerate not 14 to 16 hours a day, like a cat. A lot of cats. Maybe that's why I do that. I have a lot of cats. That's a whole nother discussion. There have been comments about me and my cats, but anyway, I have 5.5 cats. I'm gonna leave it at that. I'll let you ponder. But the fatigue changes. So, you're in remission. You probably don't need 14 or 16 hours of sleep, but you still might want 9 or 10 every single day. Every single day. I would like to do that now, frankly. So we don't really understand what that is. Prednisone, prednisone is really nifty for the first week, maybe the first 5 days. Because if you have felt terrible for a while and somebody puts you on prednisone, you're like, hot diggity dog, I feel fantastic. I can stay up all night for 3 days in a row and do what I want and paint the kitchen and wash the car. And I think I'll go outside and wash the car. It's 2 a.m. I won't bother the neighbors. It'll be fine. But that quickly goes to, oh my God, I literally haven't slept in 3 days. And I'm like vibrating. I'm shaking so much. And I am mean to other human beings, like really, really, really mean. To this day, there are things that I am embarrassed about. And we're talking a diagnosis in 1996, and I am still embarrassed to this day. So there you go, the meanness. But I think, the prednisone, yeah, it gives you that first little boost, but it doesn't really make you not tired after that, right? Because you're not sleeping. Nothing is sort of on a normal scale. Your metabolism is going all the time. So yeah, it just is terrible. It's terrible, the fatigue.
So getting back to what was I going to say? I'm sorry.
God, I'm contagious.
I'm 57, so,
Oh, I'm older than you. It's worse.
I've been told by my rheumatologist that my inflammation markers are stable, but yet I still have the fatigue. So that's the frustrating thing, because it's almost like, well, am I imposter? I mean, am I just pretending here?
Yeah, you're not. That is truly what people experience. I can tell you from my own personal experience, I can, to this day, we're talking what, approaching 30 years later, I can still remember not being able to keep my eyes open. Literally not being able to keep my eyes open. I still had to go to work every day. I still did have to walk my dog every day. And it was awful. And then I got treated, and then I finally went into remission, and I was still awfully tired. I'm going to tell you, and I don't tell you this to make you depressed or anything, but I'm pretty sure I'm still tired. Could be a little bit different now. And you just have to rest when you need to rest, to the extent you're able. Again, people have to get things done.
I'm a working retired teacher, so I'm tired and then went back to work. My daughter's 18. I gotta finish putting her through college.
Oh, yeah, that's so nice of you. You could just tell her to think about herself, I guess. I don't have kids. That's why I'm allowed to say stuff like that. I have cats. Remember I said that, 5.5. I'll tell you about that at the end, maybe. So that you reminded me of the thing that I couldn't remember a while ago because of my 60itis is, I'll just give you some examples and you may identify with these. You might be the patient who didn't feel well, goes to the doctor. Your creatinine is 8. I would guess many of you know what that means. Meaning your kidneys are not working. You come to the emergency room, you get biopsied, you get a diagnosis. But when I run into the emergency room to meet you, because I think I already know what's going on, you have all these wonderful family members around you who adore you. You're, by the way, a 58-year-old man, 57-year-old man, and you come to clinic and one of your sisters comes with you just to make sure that you remember everything and everything is done. You're a perfectly capable human being, but you have and your kids, and it's just wonderful. It's wonderful. You might be my patient who only had renal involvement diagnosed when I first got to Dartmouth, so approaching 9 years ago, never had a flare, all things in all, relatively mild disease, kidney function is stable. I thought her husband was going to have a nervous breakdown. He's in tears. He's like, "Oh my God, is she going to be?" I'm like, "She's going to be fine." Like he's fine now, but that was early on. You might be my patient who is in her 70s, fairly new diagnosis within the past year, who for I don't know how many years, but a long time ago was when it was in an incredibly, profoundly abusive marriage, like profoundly abusive, who is estranged from all 4 of her children. And her meaning in life is her adorable little Jack Russell Terrier, whom she brings to clinic, by the way. His name is Max. He's adorable. He let me pet him last time. He's decided he likes me now. So she has been doing this by herself. So there's every level of support or lack thereof. So what do you do if you don't have support? Well, it's like you say, you know, your friends might be able to support you up to a point, but if they don't really recognize exactly what you're going through, you know, how do you say, "I know I look good, but I literally can't lift that bag of trash." Like, you know,
Yeah,
yeah, that's
that's
it's
exactly.
very,
what it is.
very challenging. And so I think it was no, it might have been Eve who mentioned in the earlier panel, one of the things to help with the fatigue, but also your mental well-being, is try to have some sort of social interactions. You will not believe this, but I swear it is true. I am incredibly introverted. The only time I am not introverted is around patients. But I don't like to talk to regular people. I only like to talk to patients. So there you go. And people who know me my rest of my life know that to be true. They'll say, "Oh, do you want to go to this exercise class with me?" And I'm like, "Will there be people there?" Yes, there will. And I will be like, "No, thank you. I don't think so. It's only like 7 people. No, thank you." I'm the person, not for fatigue, but the people thing. Get to the store and be like, "Oh God, there's gonna be a lot of people in there. I can't do it. I just can't do it. I can't go in there with all those people." Or who not only doesn't go anywhere on the weekends, doesn't open the door to the outside world on the weekends. Like, it's sort of insular, reclusive. I'm not saying it's a good thing, but I do have friends, and I do have wonderful people I can talk to. So,
And you got your cats.
and I have my 5.5 cats. Okay, I'm going to tell you the half cat story. I have to tell you. So, the short version is I have 5 cats. I did have 6. My beautiful buddy, he passed away a couple years ago, right about this time. And one of our fellows adopted a kitten, little itty bitty kitten last summer. And he had never had a cat before. He is in love with this cat. He is married. They have a dog, an adorable Springer Spaniel who is just so spastic. Bless his little heart. And so shortly after he adopted her, she's little. He goes, "Well, we're going out of town to see him, his family this week." I was like, "Well, what are you going to do with Stella?" And he goes, "Oh, well, you know, I put everything away she could get into." And I went, "You didn't." And I know you may think you did, but you didn't. That is in fact impossible to do. You cannot put everything away that a kitten will get into. He's like, "Oh, well, I guess we could take her with us." And I went, "Or?" Because I met her the day that he got her. He stopped at my house to show her to me. And then I had some supplies for him to use. And so now it's just a given. if they're gonna be out of town, Stella comes to my house, which we refer to as Disneyland. So this running joke about how I have partial custody of his cat. Yeah, so that is my half a cat, Stella, and she is naughty, man, she is naughty. She's beautiful, she's really smart. So apparently the housekeeper, he and Emma and I have the same housekeeper, and she was at their house cleaning the kitchen, had the counter all nice and clean, and there's a big bowl of onions on the counter, and Stella willfully and deliberately goes and lays in the bowl of onions, rolls around. So she's got onion skins all over her. Then gets out of the bowl and is walking and rolling all over the counter. You thought you cleaned it, but you did it. And so she had to do it all over again. First, she had to catch Stella and clean her off. So anyway, so that's my 5.5 cat story. But anyway, so, you know, and they, for me, like if I was sick at this time, they would be my comfort because they're my joy. But it can be very challenging depending on whom you have around you to support you. It is very hard to do alone. It is very, very hard. I'd like to think like my poor lady who actually, after she got sick, she did talk to a couple of her children finally, and one of them moved up to the area. So that seemed like a good thing. But I'd like to think that she can view me as her support. She will never call me to say anything's wrong. I can promise you that she is never going to call me and say anything is wrong. But at least when she comes to clinic, I can give her whatever I can give her, is my hope for that. So, what other things oh, yeah.
One quick question. You talk about diabetes.
Mhm.
Is it type 1 or type 2 diabetes that you?
So the prednisone is making my glucose
Mhm.
go up. And so I'm trying to eat like a diabetic would, trying
Yeah.
to manage it without being on medicine. And so that's where the question's coming from.
Oh, yeah, that's always the
Type
question.
2 or type 1 or.
Yeah, so that would be type 2 if it was frank diabetes. Now you may find that your blood sugar goes back to normal. What we find sometimes is that what prednisone does is unmask somebody who is already predisposed to diabetes.
Oh.
So that I'm sorry to tell you, that might end up being a long-term thing, but
Diabetes.
yeah, but that's sometimes what will happen. But it would definitely be a type 2 sort of thing, sort of an insulin resistance kind of issue.
Can I make a plug for the Zoom support group?
Absolutely.
So I'm new, right? And I went to the vasculitis site, was looking around, and I saw that I got an email from the foundation that there's this support group. And so I joined one on just this last Wednesday. And there were about 12 or 13 of us. And it was really kind of comforting to have other people who understood what you're going through, and then some had it for 10 years and could give suggestions to us. And it was really, really good. So
I was gonna suggest that because I'm in several of them and the conferences like this one. And if you can get to the big symposiums, that's where you make the friendships. It's 3 days, and you
Yeah,
don't
it's
have
amazing.
to. So they understand, and I've stayed in touch with, I went to my first one in can't remember now, but it's about 2015 as a matter of fact. And I still stay in touch with some of the girls I met then. So it really is helpful.
Yeah, that's awesome.
All right, we are at time, so thank you all. Thank you, Dr. Brant.